Let's do this one more time. Hi guys, my name is Joyce. Let me just fix myself. My name is Joyce and I work in the health industry, or formerly known as a healthcare worker. So I'm coming on here tonight, and then just to excuse the background, I am currently, because you'll see this is like a hospital bed with the hospital background type of thing. I am currently at work. I'm on site. I'm not on duty, but I am on site at work, so that if they do have an emergency, they'll just contact me from my phone, and then I'll stop the recording and rush to the emergency. So yes, I'm so excited, but I just don't know where to start, to be honest. 3 years ago in 2021, I think it was August 2021 until December 2024, so that's like last year, I was working for an NGO for close to 3 years. I was working in the Western Cape, and one of the things that I did with the NGO was sexual reproductive health. So that's your family planning, whether it be the administration of injectables or giving contraceptives, oral contraceptives, and doing pap smears, right? So I did a bit of sexual reproductive health. Now, whenever the clients would come for sexual reproductive health services, what I realized is most females, based on where I was working, they had a lot of questions, and there was a lot of missing information and not a lot of good knowledge. Okay, let me just say, but they didn't really have good insight on your contraceptives, right? So the knowledge and the insight wasn't that good, because they would come and then I would basically get the same questions over and over and over and over again. And I almost felt like if I explained something to someone, maybe a previous client, because sometimes I would see up to, sometimes I would see up to 40 females in one day, sometimes more than 40. Then I almost felt like, wow, you know what? I would have to basically, sometimes if I consult about 30, let's say 20 or 30 females, and out of that 30, maybe 10 of them would ask me the same question, and I would have to answer the same question over and over and over. And I was like, wow, the consultation takes so much time answering the same question over and over and over. And then I realized, okay, but then I would explain to them. I would sit down and explain to them. And then now fast forward 3 years later, I resigned from the NGO. Then I moved back to Cape Town. So I'm working in a hospital setting now, but I'm working in theater. I realized, since there are so many females that are on contraceptives, but they don't have full insight, or they just have a basic understanding on contraceptives. So then I took it upon myself. I said, you know what? Let me get a little booklet together where I will write just basic information explaining what contraceptives are, and just to bring awareness and education to females that either are not yet on contraceptives but would like to use contraceptives, females that are on contraceptives, because you'd find there's a lot of females that are on contraceptives but they don't even understand the workings and the challenges that these contraceptives come with. So I know I'm rambling, I'm talking a lot, but it's currently 10:30 and I've been attending to a lot of emergencies today, so bear with me if it seems like I'm all over the place. So I made a booklet. This booklet, such a small booklet. Oh, MSRHJ 2025. So what this means is it's My Sexual Reproductive Health Journal 2025. So I made a small booklet for the females. This is just a prototype that the printers printed out for me. It's such a beautiful cover, so sophisticated. Just have a look there. So sophisticated. So then this booklet contains basic information, but I feel like I'm going to, with the next issue, I'm going to go into more detail with each and every contraceptive, and I'll just keep adding more information, because I know Uguti, when people get the booklet, they'll probably have questions that are not being answered in the booklet. So there will be platforms where people can ask questions, where you can write maybe suggestions, then I can add it in the next issue. So please note, disclaimer, I do not make any diagnosis on this channel. Neither do I give any medical advice on this channel. This channel or this information is strictly for educational purposes only. If you have any sexual reproductive problems, issues, or challenges, please consult your nearest health provider. Do we understand each other? Please, guys, because I don't want people saying, I was listening to this channel and Joyce said A, B, and C. No. This is strictly for educational purposes. If you have any questions or any queries, you can write to me, you can inbox me, but for any issues, please consult your nearest healthcare provider so that they will be able to make a diagnosis and work out the best treatment plan for you. All right? Okay. So as soon as you open up the journal, it does say there, My Sexual Reproductive Health Journal. You'll have your name and surname, your date of birth, a folder number if you have. If you want to put it in, you can, but if you don't want to, that's fine. And your address. If you want to put in your address, that's fine. If you don't want to, that's also just okay. So this is just your information in the front. Then I have an index in the journal. There's an index in the journal. It says My Journal Index. Then you'll read, there's a few points in the journal that that I've put in. My sexual reproductive system, my monthly menstrual cycle. I need every female to know and to understand her menstrual cycle as well as the hormones. I did not go in details as such when it comes to the cycles and the hormones, but I think with the next issue I will put in just more details in regards to the hormones, what the hormones are responsible for, and you understand. My history taking. So there is, very importantly, while I still worked for the NGO, us as the NGO sisters, we were not allowed to commence or to start a client on contraceptives. We would refer them to our clinic. Then the clinic would then prescribe the appropriate contraceptives for them after they've taken a full history. You can't just start someone on contraceptives without taking a full history. Okay? So the history entails, then we would ask you probably questions like, have you had previous perhaps breast cancer or deep vein thrombus, blood clots, things like that. We need those informations. It's very essential, because based on the conclusion of the history taking, there are some contraceptives that you can take and there are some contraceptives that you cannot take. Ones that would be probably quite detrimental to your health. Maybe detrimental is such a, for the lack of a better word, maybe some contraceptives would then not work so well for you. So we would have some contraceptives that are contraindicative to your medical diagnosis. Like, let's say you have hypertension. If you have hypertension or migraines, there's some contraceptives that you can use. There's some contraceptives that you can't use. Okay? So history taking is extremely important, and we've put the questions there. You just go and you answer yes or no, whatever applies to you. My pregnancy screening. Before you start your contraceptives, I've included questions that you should be asked on your first visit when you want to commence your contraceptives. I have apologized earlier if it seems like I'm rambling. I am quite tired. But if I don't make this video now, I probably never will. So I need to make the video now. I'm just going to push through. My contraceptive choices. There are different choices. I have included them there. My monthly tuberculosis screening. So with e-contraceptives, you'd be surprised. We don't only work with e-contraceptives. I've also included e-tuberculosis screening, because you have to screen yourself. With each and every visit from my clients, I would screen them for e-TB, right? Then if they had symptoms, then we would send them to the clinic so that they can be tested for a TB. Because some of the medication, some of the TB treatment contradicts with e-contraceptives. So we have to do a TB screening. HIV and AIDS, we would then also test them for HIV and AIDS, and then do counseling. We also speak a bit about PrEP, pre-exposure prophylactics, and post-exposure prophylactics in the journal. Sexually transmitted infections, pap smear. Pap smear is extremely important, very, very important. I touch also a bit about that in the journal. And a breast exam. A monthly breast exam is very essential. Extremely important. I just want to show you guys what to expect in the journal. Remember, this is a prototype. The printer's just printed out a bigger image for me. If you have a look at that, it says there, it says my January 2025 sexual reproductive health schedule or planning. Date says January 2025. It is currently, today is the 4th of May. Today is the 4th of May, 2025, kodwa ndino January. So excuse me for that. The booklet is a bit late. So then the idea is that you will plot your, let's say, what is this? Let's say on the 6th of January, you were supposed to get maybe your Depo-Vera injectable. Then you will note it here with the sticker. I am looking for a manufacturer to manufacture stickers for me, because I need stickers. I need a contraceptive stickers, like a patch or the ring or the injectable or a pill. I need someone to do that. Yes, but I'm a China ayazithanda ke stick. So the idea is you peel off your stickers and then you go through the months, you plot the dates when you're supposed to get your contraceptive. See, do we all understand? Ne? You get your stickers, a pack of stickers. If you have a date for your contraceptives, if it's due there, you take your sticker, you peel it off, and then you paste it there. Then you remember, on your journal, when you open up your journal, you remember, on the 6th of January, I must actually go for my contraceptive. Or if you are going for a pap smear, maybe you have a pap smear appointment, then let's say you probably have the pap smear appointment on the 20th of January, then you would peel off your sticker and paste it there so that you can remember. And a breast examination, Mosba, you're supposed to do your breast examination once a month, at least 7 days after your period, or a week just before your period. Okay, you do not do your breast examination while you're on your period, because your breasts are so tender, and sometimes you can feel maybe like a mass, which is not really a mass. Remember, your breast becomes so sensitive and so engorged and so tender when you're on your period. So it is preferred that you do it a week before or after, a week or 10 days. It's in the journal. Get the journal and then you get the info. With that, whenever you go for your sexual reproductive consultation, then you can, but this block is quite small, I want it to be bigger, then you can jot there, write down the information. At every visit, there should be a blood pressure that gets done. Then you'll come and plot your blood pressure. I actually should also put in the normal ranges for you. I forgot about that. I actually should. Let me write that down. Then I'll put in the normal ranges and abnormal ranges. Normal plus abnormal ranges. I'm not gonna speak fast, because when you speak about these products, you can't just rush. Oh, this is this. Yes, and then move on to the next page. This is this. I can't rush. Besides, I'm tired. I just hope the camera doesn't run out of space while I'm still talking a lot. Then there's your pulse. You would then write your pulse, your weight, and it says contraceptive method. I'm just going to make a bigger space so that you can write your contraceptive method there. The expiry date, you should include the lot number, the injection site. If you did receive an injection, did you receive it on the deltoid? Is it now left or right? Or did you receive it on your gluteus max? on the left and the right, because with each and every consultation you must alternate. We can't give you on the same side every time. If we give it to you this time, on your next consultation you will get it on your right. On your following consultation you get it on your left again, so and so. And with certain BMIs, then they would get the contraception on the deltoid, which is our arm muscle. Right? All right. What else? And then your next date will then be included here when you should go back again for a consultation. HIV screening, if it was done, was it done, yes or no? If it was done, then you just write your result if you want to. This can be quite invasive, HIV screening, writing your result here. I think it's up to you to then work out a symbol for, like, if you did the screening and it came out negative, then you would write a symbol that symbolizes why it was negative. Good, again, this is private. It's your booklet, it's your journal. I don't expect anyone else to look into your journal. This journal will be used by you. If you want to take it with you to your consultation, it's fine. If you don't want to take it with you, you can always come back from your consultation and then come and plot in your journal. Understood? Because they do give you appointment cards, and then you can always come write it here. And most of the info is on the card. You can just come and transfer it on in your booklet or on your journal. TB screening, yes or no? Then symptoms, we have included all the symptoms. You will have every month, you have to read the symptoms, then you'll have to answer yes or no. And then a self-breast exam, was it done? And then symptoms as well. Like, let me just show you an example. All right. It's not stapled, so it's all over the place. You'll see it's such a very big. I don't even have page numbers, but I don't need page numbers. All right. My sexual reproductive system. I didn't include the external genitalia. Perhaps I should. Maybe in the next issue I will. But you'll see this diagram that shows the uterus with the fallopian tubes and the ovaries. That is the vaginal canal with the cervix up there. Sorry. Yeah. And then the endometrium. There's labels that explain everything. And then if you open it wide, you will see I explain everything on the other side. Like, what is a uterus? Uterus, also known as the womb. Then I explain what it is. Fallopian tubes, I explain what they are, what they're responsible for. Ovaries, the cervix, the vagina. Yes. Buy the journal so that you can see the info. Then this journal, I said it will be like a conversation starter between sisters, friends, cousins, between single fathers that are raising daughters. Single fathers that are raising daughters, sometimes discussing such information can be quite overwhelming for the father. Mhlambe utata can feel uncomfortable. But if they can just buy the journal for the daughter, go through the journal with their children, read it for them, because At first, when I developed the booklet, I used a lot of medical terms, and it was so, I wrote it in such a way, it was made for health providers who understood the medical lingo. And then at some point I'm like, no man, I am not writing the journal, or I'm not creating the booklet or the journal for health providers. I am creating it for the normal person who just wants basic information just to understand and get a picture of reproductive health. And I wrote it, it's so simple, you will understand it. It's so simple. I oversimplified. I made it so simple so that people could understand it. And people love things they can understand. Okay? Like, I'm not going to speak about zygotes up or ovum, stuff like that. No. I'm going to speak about an egg so that you understand it's an egg. You understand? So, yes. Okay, let me see what else I can show you guys. It's been 26 minutes. I don't want it to be too long. But I think as the days go by, I will then keep making videos, and maybe we can discuss certain pieces of the journal. Then we can go through it and discuss it. Maybe we can have like a questionnaire and stuff like that. Yeah, I am so excited. I am on Facebook. It is MSRHJ, My Sexual Reproductive Health Journal 2025. You'll see it on Facebook. I created the account last week. I think on Instagram as well, TikTok, and YouTube, because I'm going to post this on YouTube. MSRHJ. You can, on Facebook, I've included a number that you can inbox if you want to order the journal. Order your journal now, guys. Ordani i-journal zenu. Nifunde so that you can learn about your body. As a female, you must understand your body. You must understand how it works. You must understand the intricacies of how your womb works and all those things. The journal is quite interesting. And remember, with each and every issue, I'll have more information. We'll go in depth. This is just the first phase, basic phase, foundation phase. And I will take it up a notch with each and every issue, because I need y'all to understand your bodies. I need y'all to understand your wombs, how sacred and special and amazing your wombs and your brain is. Your brain, there is the hypothalamus and the pituitary gland, which triggers certain hormones to be released, right? Those hormones are being released. So it triggers messages so that certain hormones can be released. Then your ovaries produces these hormones. Depending on the hormone, depending on the level of the hormone in your system, you can have your period, you can produce an egg. Like, it's amazing. But we will go through it. For now, I'm a bit tired and I'm gonna rest. And I thank you for your time, for listening to me. Ngiyabonga kakhulu. I'm so grateful. The time, it's been 30 minutes. I've been recording for 30 minutes. Ndiyacima ngoku le video. Hayi ndiyacima. Oh, before ndiyicima, where's the breast? my Canon camera decided while I was talking too much that it had already been 30 minutes and I've been talking and talking and talking. And I still wanted to show the breast exam part of the journal. But I'll do a follow-up video on that. So yeah, thank you for watching. Thank you for your time. And yeah, I hope that you guys do order the journal, that you find it very useful, and yeah, and that you like it. I'll do a part 2. Yeah, I'll do a follow-up video. But for now, bye.